Hello, everyone, and welcome to our YouTube live session. And this YouTube live is hosted by Oneness Education Foundation. My name is Ifeoluwa Konde, and I'm the Community Wellness Program Manager for Oneness Education Foundation. We are thrilled to have you join us today for what promises to be an enlightening and I believe also supportive discussion, right? So today we'll be exploring the intricacies of residency application process for internationally trained medical graduates. And our special focus will be on the immigrant experience, especially for Ontario. Here today, we are honored to have our own doctor, Dr. Maka, with us today. And she will be sharing her personal experience and valuable insight to help everyone understand how to navigate this important pathway. Thank you all for being here. And right now, let us dive in and make the most of this session. So, as an introduction, because I know some of us will be wondering, what is Oneness Education Foundation? And so I'm just going to give a brief introduction as to what we do at Oneness and what our focus is. So, at Oneness Education Foundation, our mission is to expedite the transitioning of internationally educated healthcare professionals from non-practice to practice status within the shortest possible time. So, and we envision this in Canada, where internationally trained healthcare professionals seamlessly return to their careers, especially the career they deserve, with the dignity and the honor they deserve, thereby contributing their skills and expertise to the community that we would love to serve. All right. So for today, the purpose of this session is just to help us internationally trained healthcare professional, especially physician. This one is specifically for physician to understand the complexity of the residency application process in Canada, which everybody knows as CAMS. And through Dr. Amaka today, I am sure our personal story and our professional insights will help us shed light on the challenges and the barriers we face as IMGs, and from navigating exams like QE1, NAC OSCE, and also how we balance our life as an immigrant, as a wife or husband and parents. I believe this section is going to be very practical and also inspirational for everyone. And I believe it will also provide us the tools and knowledge and also motivation. We need a lot of that now, right? Motivation to really integrate well into the Canadian healthcare system. But before we start, I'm just going to put some ground rules. We promise that today's session is going to be as short as possible. We're not going to bore you with a lot of lengthy session, and also we appreciate your participation as our audience. Please throw in your questions, and if by any chance you have a little bit of technical difficulties, please log out and log in, and still you have us here and you can continue to join the session. And if you are unable to finish with us, maybe because of one reason or another, please don't worry, don't fret. This session will be recorded and will be you can access it on our YouTube page. All right. And please feel free to share tips, questions. We are open to it. That is what will make this session very interesting for us. We are here to hear from you, and Dr. Maka is here to answer all your questions. Dr. Maka, am I right?
I hope I can.
Okay. Before we start, as we all do, we know this place we occupy, it is we are it's just like we are borrowing it. So for every session or anything, the first thing we try to do is to acknowledge the land for which we stand on. So for today, we want to take this moment to acknowledge that we are gathering on the traditional territory of the Indigenous people. In the spirit of reconciliation, we recognize that this land which we live and work is the ancestral land of the First Nation, Inuit, Métis people, and we honor the Indigenous people who have stewarded those lands for generations and commitments to learning and growing. Okay, so For today, I know most of us, or maybe few of us, will know Dr. Maka because we don't know. But for those that don't know Dr. Maka, I'm just going to give like a brief introduction. She's still going to introduce herself. So, Dr. Maka is a resident physician, right? Currently a resident physician at Northern Ontario School of Medicine. Dr. Maka,
Correct.
okay.
Yeah.
All right. Not to take too much of our time, we'll kick in into the session now. All right, Dr. Maka, welcome.
Thank you. Thank
Thank
you
you
for
for
having me.
gracing us today.
Thank you for having me.
Thank you so much for. I know you're a very busy person, but this means a lot to us, and I'm sure it means a lot to a lot of IMGs out there. So, as a kickstart, could you please tell us who is Dr. Maka? And just give us a little bit about your story.
Okay, so this is Dr. Maka. You
Okay.
can call me Amaka if you want. I'm from Nigeria, currently a resident, psychiatry resident at Northern University, that's Northern Ontario School of Medicine. My primary site is Sault Ste. Marie. I know most of us don't know what that is.
This is my first time of hearing that.
Sault Ste. Marie, so SAULT.
Okay.
S.
I'll search that up.
Good. So Sault Ste. Marie, and I am married. I have three amazing kids, two boys and a girl. And so I'll just give a little bit of history about what I have done in the past till
Okay.
date. So
Mm-hmm.
before I move ahead, I love volleyball. I'm sure a couple of people know. I love
Oh,
volleyball, yes, and my favorite
yeah.
color is purple.
Whoa. I think we are twinning on that. I love purple. Unfortunately, I'm not wearing that today, but okay. Okay, that's
Yes,
good to
I
know.
love purple. I love music. I love dancing.
Oh my God.
Even if I'm not a great dancer, but I
Are you
just
sure we are not sisters from somewhere? Okay.
okay. So taking it right back, I graduated or completed medical school from Windsor University School of Medicine in St. Kitts.
Okay.
I didn't start there actually. I started med school in Nigeria at Madonna University to be
Mm,
precise. I was there for about 6 years and then I transferred to Windsor where I completed med school. I'm really grateful that I did. And I actually went back to Nigeria. So I got married, I went back to Nigeria and I did what we call the National Youth Service Corps, where more like or would I say community, a program where you serve the
community.
community.
Yeah.
Yeah. So I did that. I wrote my primaries in family medicine. I practiced as a GP as well, had postgraduate training in family medicine as well. Didn't complete that before I immigrated down to Canada.
Mm, okay.
Yeah, I would say all of that's put it to about say 5 to almost 7 years in the field of that practicing medicine before moving to Canada.
Okay.
Yeah, so I think that should.
Okay, that's interesting to know. And some of us finished there, then worked for a while and moved here. I'm sure a lot of my audience will relate with that. And we have some like you that had to break it. We understand why that happened. We just keep that. We don't talk about it for now. Okay. Yeah. All right. Thank you so much, Dr. Amaka, for that background story. It's something most of us can relate with. Most of us did our undergraduate somewhere, then find ourselves in Canada. That's why we're here today, just to help others to be able to, also navigate this thing well. My question again is, I know you've faced a lot of challenges, right? Even as an immigrant, as an IMG, as a
Yes,
wife, as
say
a
that
mother.
and say
I
that
know
again.
you faced a lot of things, right? Could you just tell us about what is that significant barrier that you encountered in your journey to licensing in Canada and where you are today?
Okay, so speaking about barriers, to be honest, I would say you cannot exhaust that topic. It would be best to say write a book on it because I think that's the issue. People just think maybe barriers, yeah, there are a couple of them, you list it, and yeah, I think I can get through that. No, like you cannot exhaust that. No, not at all.
Mm,
But I'll speak about the most common ones. or would I say not really common? Okay, common, but the one that impacted me the most,
Yeah.
I would say the
Okay.
ones I can remember, because I would say it's a phase of your life, and after a while, especially except if you journal a lot, sometimes we tend to forget as well.
Yeah.
The very first one I would say is finances. So most of us immigrate to Canada. Our money definitely is put towards the immigration.
Mm-hmm.
You want to come here, make your family comfortable. You have kids. I have three kids and my husband as well. Finances was the bulk, would I say, our major problem. We, I really didn't want my family to feel that financial strain because I was taking an exam. However, I knew that it was something I had to do.
Okay.
We found a way around it. We were so blessed. My husband got a job before we landed in Canada. So when
Oh,
he came, he started work right away. And that really helped. Regardless of that, it was still a struggle because I
okay.
really didn't know that the journey was an endless bit of continuous money spending. You're always going to spend money till you're finally in.
Right.
It's going to spend. It never ends. It was a shocker for me when I get to, and I'm like, oh yeah, finally this is done. And then the next thing you find out, oh my god, I have to spend $500 again. And then just as you pay for that, you're like, oh my god, I have to pay another
Just keep
350.
coming.
It keeps
Mm.
going. It never ends. So
Okay.
I think it was finances. Another
Okay.
thing is the issue of information. So there's really not much information out there.
Mm.
It's available. It might not just be in your circle or in your community. If you're lucky to be among people or you have the community that is very supportive, you have the information available to you, I think that's one hurdle crossed. So
Okay.
I was really glad when I really know more. And then I found you guys that the oneness,
Okay.
this is fantastic.
Yeah.
Yes, every
I know.
IMGs really need that.
I know. I
And
know.
then, apart from information, the thing is the anxiety and fear of I really don't know what I'm expected to do. What exactly am I supposed to do to finally get into this? The
Mm.
information is not clear cut. It's out there.
Straightforward.
You
Yeah.
have the websites where you can go to, you find out the steps, but it's really not as straightforward as it sounds or as it's
Mm.
put out there. So I would say those are the major barriers. Then the other things I think are things you can actually you'll be fine. But for finances, if you don't know, it's going and you are not able to, it delays you, stresses you out. Imagine you're the breadwinner of the family. For me, I had to stop work and study. Imagine I didn't have someone who was working to support myself and the kids. That's going to be like a challenge.
Yeah.
And then if you don't have the information, that's going to be hard as well. So I think
I
those are
mean,
the major things.
oh, okay. I mean, I'm sure most of our IMGs can relate with what you've just said. That it's more like something all of us have to go through. At the end of the day, that's why oneness is here. That was one of the gaps one of the issue we noticed, and we felt we need to bridge this gap. And I'm glad you're also talking about it now, because it means a lot when you're coming into a country and you have a direction, like you know what to expect, you know what to do. It makes your journey faster, right? Okay, just a follow-up question to what you really did great with the answering of that question. I know, yeah, you had some challenge, but what are those things that helped you to be able to, through these challenges? Was there resources? Do you have like mentors, or did you join a community? Or what really helped you to really go through this and come out strong?
Okay, so for that question, I would like to start first by saying everybody's journey is different.
Okay.
There are people who necessarily didn't have some of the things I may mention, but
Okay.
still did. Some people have way more and are yet to actually still succeed and get in. So I wouldn't say it's exactly about that, but I think it's finding the peculiarities and what exactly would meet the goals that you actually need. For me, I would say community was like my push. Or would I say that was the force that got me to wherever I am now? Community and God, my faith actually. So
Okay.
for the community, I would say I have very, very of mentors. Like, I have physicians who, even while in residency, I remember some of the things they have taught me. Some people stuck out their neck to help me, teach me, and get me here. So when mentors, people that I worked with as clinical assistants or as a physician assistant, the psychiatrist I had worked with, physicians I had worked with as like family physicians I had worked with also as a clinical assistant, other physicians in my community that I had reached out to and spoken to them about my passion, my desire, my goals, my objectives, and they picked it up and were like, you know what? They're going to help me. And then they tell me, you need to do this. Are you doing this? Keeping me on my toes, trying to make sure I was getting things right.
You had that sense of accountability somehow, someone that is looking out for you.
Exactly. Someone you could always say, oh, I'm doing this. What do you think? Oh, this is what I'm doing. What do you think about this? Always getting that input from people who were already there. Then apart from that, so taking it is a step down. So I was also fortunate to have a community of my fellow Nigerian doctors. So I happen to be in a group of other fellow Nigerians where people who have gone ahead, other residents who had matched, other people and physicians who were practicing constantly are out there to help you guys that are applying. What do you guys need? Do you have questions? Always there to guide those of us who were coming. It was priceless. Some of them I don't know their names. Some of them I absolutely know their name. Like lots, I can't even mention names. But it was very helpful. That information, knowing that you're going and you think you're doing the right, and they're like, no, stop. You're not supposed to do that. Don't
Go
do this.
this way,
No.
go that way.
So it really, really helps. It really, and
Yeah.
then you also from that create a community. I also now got to get a community of fellow physicians who were all on the same journey, who have become like sisters. That was also so. You see why I said community was a major burden. Not to talk about family, not talk about friends who are always there checking in on you, like Momo, my friend. What's up? How and the rest. So when people constantly checking on you, no matter how down you feel, the fact that you have people you're communicating with, you are checking in with them, oh, this is what I'm doing. You actually speak to yourself, oh, I'm actually making progress, oh, I'm actually doing something. I'm not actually just lagging behind. I think that's very helpful.
Yeah,
That was one thing that helped me. And then that faith in God, the f- it feel like an endless journey. But when you constantly pray and just try to renew your strength with your faith, I think it's kept me.
that is, you're very right. Community, having family support, and your faith also is a big thing that we should not ignore at all. And having that community, that is this thing that it does to you. Sometimes you just want to rant. You just want somewhere to vent, and you just need someone to listen. I'm like, you know what? I understand. I've been there. This is it brings some clarity, right? You cannot underestimate the power of community, and that is what.
Sometimes it would feel like you are sinking and you are coming out of nowhere. But from
Mhm.
speaking with people, they actually no, you have done this, you did this,
Yeah.
and then you actually see that, oh, I'm actually getting some. And when you rant, like you said, that it's you
You
kind of
unburden
create
yourself.
space,
Yeah,
yeah,
you
you
feel
create
lighter.
space for more. Exactly, yeah.
Yes. That's one of the reason why Oneness Education Foundation is here. That is one of the things we also do for our members. You can talk to us. You can unburden yourself. It makes you lighter to think clearer, and you can when you think clearer, you can think forward and move forward. And the benefit of community again is there is this adage, like when you walk alone, you walk far, but when you work with people, you go farther. And that is what Oneness Education Foundation stands for. When you walk further, it's faster, and you get to where you're going in no time, right? I really appreciate you sharing that with us. I also want to ask for the new IMGs that are watching us now. Could you please just walk us through all the residency application process itself? Because I'm sure some people some people are also watching us from outside Canada. So they want to know, oh, I want to come to Canada. I want to practice medicine. I'm a physician back home. What is the process? At least if I know the process from before coming to Canada, whatever preparation I need to do before coming, it makes it easier for me when I come in. And for those that are already here, oh, okay, I didn't know this is what I need to do. Okay, let me retrace back my step. Can you please break it down for us? Walk us through it. The residency application process, talking about CAMS, QE1, NAC OSCE, and stuff like that. And if possible, what cost should we prepare for when planning all this?
Okay, so I don't think I can exhaustively give precise details to everything,
That's
but
okay. Just something helpful, right?
yeah, so I'm going to give a rundown, but most of that information, if you actually check MCC's website, just gives an overview, but I will explain or say it more
Yes.
practically from my own
Mm-hmm.
experience.
Yeah.
Some people go through different because there are different routes to licensure. I happen to actually try two routes because I'm sure there are other routes. I
Okay.
tried the PRA route and then also the CAMS route, but I ended up dumping the PRA, even if it seemed like it was going and went with
Okay.
CAMS. So first things first is you have to at least open an account with physician and with MCC, that's the Physicians Apply website and portal.
Mm-hmm.
Open an account, identify or verify your identification and verify your credentials. So anybody can come and say, I want to write QE1. How sure are we you're a physician? It's meant for physicians, right?
Dr. Maka, if you don't mind, I'm just going to pause you just for now. Guys, please, if you have questions, please send them in now. Dr. Maka is going to dissect it, break it, decompose it for us today. So please send in your questions. As she continues, I'll be looking forward to reading your questions so that when she's done, we can just throw in your question and Dr. Amaka will be able to help us with that. You can go on now, Dr. Maka.
Okay, so you verify your documents. That's pretty straightforward. Once you open the account, there are instructions on how to do that. When you verify your credentials, you get a number, like a candidate code number, and all of that. You, at that point, can now sit for examinations. So you write the first exam, QE1. Some people say it's not compulsory to write the QE1 first, which is really understandable. Some people are able to write the NAC OSCE exam first, which can make sense for them. Some people are working as physician assistants and are pretty much doing the things that the exam mostly simulates. So for them, they feel more comfortable and ready to take the NACOSCI. And it's fine. A couple of people have done that and done so very successfully. So it's up to you. Basically, there are two exams. We have the MCCQE1, which is going to be switching now. Previously used to be MCQ questions and CDM, but now it's going to be fully MCQs from next 2025, I think in April.
Oh, that's good.
So after writing that
Good. That's
exam,
good news. Yeah.
good news. Yeah, I know. For some people feel uncomfortable about it, but I feel like it sounds like good news. We would not know until it happens, but
Yeah.
those are the changes for now. So after the QE1 exam and the NACOSCI exam, the NACOSCI exam is mostly clinical exam where you are going to see patients. It's like simulating you seeing a patient for a couple of minutes. It's timed. You see the patients and then you are able to come up. You have questions, follow-up questions from the case. So after writing both exams successfully, you can at that point now go ahead to do whatever you want to do. So depending on your experience, some people have credentials that make them eligible for certain streams. There are several different provinces have different type. Ontario has the Practice Ready Ontario program. Alberta has the same. British Columbia has the same. Nova Scotia, pretty much almost all the provinces have theirs. You can as well say, okay, I think you have to find out on their website if you're eligible. If you're eligible, you can just apply. Some provinces actually don't even take NACOSCI. They actually just require QE1. So if you know from the beginning which province you're eligible for, you can apply right as soon as you're done with the QE1. So if you're going for CAMS, then you need to now do the work. So I think maybe there should be other questions that will answer this, but let me just give the rundown. So if you're going to the PRA, you find out first if which province or the provinces you're eligible for, what you need. If you need the QE1, you need the NACOSCI and then other documents. So once you write, you can now go ahead to do that. Something I forgot to mention is once you're done with the MCC QE1, if from your home country you've done like internship, let me use my home country, Nigeria, for example. We happen to have internship after your, like, where you get the provisional license.
Mhm.
If you've had that, you are able to prove that by sending a letter that you were given at the end, or a certificate of the completion of your internship. You verify that with MCC, just like you verified your degree. You can get what we call the license sheets of the Medical Council of Canada, LMCC. When you get that, some programs in camps actually accept it in place of camp. So it depends. Some provinces accept it as well, like when they are request for it when you're going for PRA. So it's something that once you've done your QE1 and you have the internship, like 1 year of internship, you can apply for that. So maybe I'll stop there and then we can take it up further, depending on the
Yeah.
question.
Okay. Oh, thank you so much, Dr. Amaka. You really gave us the breakdown because there are some things you're saying now that is new to me and is added knowledge for me. This issue of removing CDM and just MCQ alone, to me, I think is great. It's great because at the end of the day, now you know that you know what to focus on. You are not thinking of okay, clinical decision, blah blah blah. You're just focusing on MCQ, get it right and get started, right? So I don't know what other people think, but let me know what you think like in the comments. For me, I think it's great. All right. I know medicine is the basics of medicine is the same everywhere, just a little differences. So how would you compare what you're doing now to what you've been doing before? And also, what should immigrant physician prepare for in terms of changes, like culture or whatever? Can you just elaborate on that?
Okay, so I would say for the difference, so it's very different. Every country is different. Canada is a Western country, and it's very different from the countries where a lot of us come from. Some of us come
Mhm.
from developing countries, some of us from underdeveloped countries, and it's definitely different. That I feel like that's the reason why the exams were put in there, because they want you to actually have some sort of foundational knowledge of certain things like ethics.
Mm.
It's very different. You have to know those very well at the tip of your fingers. Like, things are different. Communication style is
Mm.
different in Canada. People have a different way of seeing things. We culturally see things differently from where we come from and how it is here. This is a very, what I say, it's a country with people from diverse backgrounds,
Mm.
diverse multicultural country. So you have to understand how to be able to communicate with different people. So I think that's mostly the difference. Another thing is understanding that things are done in Canada based on guidelines and the standard of care.
Protocols.
Exactly. You have to do things right. So, what does the guideline say? Is that the right thing to do? Some of us come from countries where, yes, we have the guidelines, we have the standard of doing things, but maybe there are issues, or you are in a place that is underserved and you have to
Mhm.
kind of improvise. Not like you're doing anything wrong, but what you need is not available and you have to make things work somehow. In Canada, you have to do what you're supposed to do. There are times where you have to just do certain things just to make sure things go right and save
Yeah.
the person. It's really not about the book at that time, but you have to do things right. So far, I'm not practicing independently. I'm a resident physician, so
Mhm.
I work with my preceptors and staff. But from what I've seen, everybody does everything right. There's a protocol, there's a way to do stuff. We follow ethics, we respect people, and you ultimately are just out there to make sure patients feel better. So I would say that's mostly the difference. For what people should look out for, I would say you're not just writing the exam just because you just have to get it over with and get your license. It's a process for a reason. You're learning those things for a reason. There are some medications that you come across while writing QE1. In, let me use Toronto Notes for example, it puts the brand name there. It's a good idea to know it because that's the brand name that's going to be known here. So knowing some of those things are important ethics. You cannot understate
They're
that.
big on that.
Very big because at the end of the day, we are humans. We are dealing with humans. We have a personality of our own. We are dealing with other people who have different personalities as well. But there should be some sort of ground rules in how to relate and treat other people. Doctors have some sort of, you're basically dealing with someone's life.
Like,
Yeah, so that ethics is important. It makes you know that you have to respect this person, respect the person you're taking care of, and you're there serving that person to help the person. So, knowing those things, not just going through the exam, because some of us are very good test takers. We do, and then at the end of the day, you really didn't learn what you're supposed to learn. And then it becomes a challenge, and you're like, I think I've seen this somewhere. What am I supposed to do? No, no. But if you actually learnt it, it becomes part of you. Don't, it's a process, and if you look at it like you're building and growing yourself and in your career, I think it would really help. So I think that should be what we should look out for. So while going through the exams, oh, I'm in Canada now. Imagine you're learning after you're on
and
learning,
relearning.
learning
Yeah.
new things exactly. So
Mm.
I think having that at the back of our minds would really help us on the journey.
Yeah, that thank you so much, Dr. Amaka. Like one example I can give personal story. When I first got here, I was having headache, and when I came, I brought in my own paracetamol and everything. So when it finished, I was like, okay, let me go to the store to get something. Then I started looking around, there's no paracetamol. I was like, I had to go to the pharmacy, like, I have this. I like, okay, oh, buy Tylenol. That was my first time of hearing Tylenol. So I was like, oh, so that kind of thing. Imagine coming from another country, like those little things, something we can learn even before coming here.
Yeah,
Okay, the common medications, what are they called here? Advil, all those things. So that when you come, you don't feel too different. You
yeah,
just know that you just need little adjustment here and there, and you're good to go. And also, like you said, coming into another country, yes, you know a lot, but you have to be open to learn new things because that is the only way you can quickly integrate.
yeah.
And it also shows in when you're doing your NAC OSCE, you won't look like a new person. You just look as if you've been with them for a long time. Open to learning new things, asking questions. Don't be too shy. Just
Okay.
and that's one of the reasons why we are here. Throw your question at us. Oneness Education Foundation will surely get someone to answer your question. And also having that like mentorship is also a way to help you around those things because it's gonna be tough trying to do it alone.
Can do,
Right?
you cannot
It's going to
do
be
it alone
tough.
at all.
I'm
And
telling
you
you.
know, one other thing that I would mention may not have applied to me, but it just occurred to me that there might be people who are peculiar. So some countries, so my home country, Nigeria, we speak
Hmm.
English. English is literally our first language. There's
Yeah,
some countries where English is not their first language.
exactly.
And it's a
Yes.
major barrier because
Hmm.
I have a couple of friends who are from countries where they speak Spanish and they don't speak English or they speak other languages. They have to cross that hurdle first of learning English, and
Hmm.
it is remarkably hard for adults.
I know.
And,
Going back to
you
school,
know,
reading ABCs.
but not even just learning to speak the English to communicate, you now have to learn the medical terms.
Hmm. Yeah.
It's remarkably hard to imagine, not to talk about going through it. So that's why sometimes it takes people 2, 3 years to actually get that sorted before they even start thinking about the exam.
Yes.
So it's something to also put in
Into
mind that
country.
if
Yes.
that's if that's your story and your journey, please don't even feel bad and think you're delaying.
No,
It's
not at
different
all.
for you. The only you are at advantage because you become someone who can, you are multilingual. By the time you get
Mhm.
to practice, you have an advantage over other people who speak just English. So don't look at it as a disadvantage. It's actually
Yeah.
an advantage. Might take you longer, but it's not.
Like what you're very right. What we're just saying. If it's something you can even start learning before coming, right? You're coming into Canada and the people you're going to be relating with are speaking English. 6 months into coming, start learning English, start learning the medical terms. So when you land there, you just look like you just come out straight, fresh.
Yeah,
Nobody will even know that you just started learning it. And it will also help you in your journey, make it also faster because you don't need to waste another 1 or 2 years learning English in Canada. So you just know that no, that hurdle has been you crossed. So the next step is what you try to get into instead of breaking it, learning English and all those stuff. And that also can also delay your recency of practice. Also, it can also delay that because if you come into Canada and you started, you're wasting years, and it's also counting against your recency of practice. It's a good thing that you mentioned it, learning English and before you become multilingual, right? Someone come into your clinic, I can't speak it. Oh yeah, I can. You become like especially a target, like oh doctor, this can do
yes.
this,
You
doctor,
have
this
that
can
added.
added value. Thank you so much for sharing that. So we talked about networking and also I want to know what I know you talked about mentorship and how it helped you in terms of preparation and exams. So how did they actually help in terms of getting into the residency itself?
Okay.
Yeah, how did the networking? Because people want to know that do you need to know somebody? What in terms of getting match itself? How would you say networking helped you?
I think it's different for different people. So for me, I'm so blessed to have like several kinds of people in my corner.
Hmm.
So there are people who could be your mentors for the purpose of guiding you through the process. So some people who have gone through the process may have been different in their time, but there are things that they've gone through that are similar. Their experience would help you. Their mistakes would help you prevent that same mistake. Or they probably know someone who made a mistake and they tell you, oh no, don't do that. This person had this problem with this. I think you should do this. It would be better. So I think there are mentors who would help in that way. There are also mentors who you are looking up to, you really want to be like them. For me, I had a psychiatrist. I hope it's not wrong to mention his name. His name is Dr. Udo. I'm
Okay.
so proud. I'm really blessed and grateful that I worked with him. He's phenomenal. I'm an amazing psychiatrist. And I was like, God, I wish I could just be three quarter. I don't want to say half. I really want to be as good as he is, but three quarter as good as he is. So such mentors are great because not only would they teach you, oh yes, to be a good psychiatrist, you need to know. Not only would he teach you like the work itself, but they would also help you by telling you their own story, the portfolios they built before they got to where they were. So he had told me, oh yeah, when I had my interviews, these are the kinds of things they asked me. This is how they want you to think. If I were to be interviewing residents, these are the things I want to hear. Because he's there, he's at that place where he has been in a leadership role. He knows what they're looking out for. And he tells you to be a good psychiatrist, you have to do this. And then he puts you in place. Even if you
Hmm.
don't have that, you build that skill. You need to learn this, you need to read this, you need to check this out. They help you. There are also mentors who would help you through the journey. They might not be doctors, but they are great communicators, or they are
Okay.
great with helping you through your personal statement for your residency application, or it could be for putting your application together. Those kind of mentors are great as well. You can't say because they are not doctors, but they can help. There are people who may not have even matched, but they have the information, they know what they're saying. So I don't think mentors are just maybe doctors, but anybody who is instrumental through your journey in terms of inspiring a knowledge, or they are inspirational in terms of creating that knowledge that you need on that journey.
Mm-hmm.
Different for residency. it's different. For PRA or other MLPMG and the rest of them, it's different. There are people who will tell you, oh, for your recency of practice, I think they will give you that information. For
All
some,
right.
they will tell you for residency, you need to have built this, because that was one of the things that really helped me. I had I took time to get information about I knew I wanted to do residency. I
Okay.
didn't want to do PRA, so I spent time to get information for residency. And then after spending so much time to get that information, I knew this was what, and the information basically from people who had matched, they had said of what I did. Listening to 20, 30 people, I was able to put things together. I was like, oh,
Okay.
this is what I needed to do, this is what I needed to do. And that was how I was able to,
Really.
all of
Oh,
that put together help.
that's interesting, and that's good. I'm sure someone out there too is already thinking of someone. Okay, who will be my mentor? Who is in my field of choice? Who can I connect with? And I'm sure with this information you've shared now, it's already lightening a bulb in their head. Okay, I'm gonna do this and that. So I think now we go into the question proper. Some of our audience are sending in question now. So the first question is from Adetola Adeoye, and I want to believe it's a she, said, "Hello, good evening. Thank you for the platform. I did my physician apply and was trying to verify my internship, but it's proving difficult. Can I go ahead with booking my exams?" Then there was a follow-up question. Then I said, already verified my license, also got my medical certificate verified too. So I think the major thing here is in terms of verifying her internship, it's been proven difficult. Can she go ahead to book the exam?
So I think for the exam, it doesn't have anything to do. You don't need your internship to write the exams. What you need to write the exam is to have an account with MCC. They've proven that you're a medical doctor. If you actually go to examination, the fact that it shows that you can book your exam, you can book your exam. But booking the exam doesn't mean that, okay, or let me put it this way, verifying your license doesn't mean you should go immediately to write your exam. You are not just writing the exam, you're writing the exam with the intent to pass and
Oh,
pass well. So you need to be ready for the exam. First of all, know that you don't need the internship to write the exam. So from what you are saying, if you verified your credentials, you are good to go
you are
to,
good to go.
but make sure you're ready for the exam. For CAMS, scores matter. So you, although I won't say 100% matter, because some people don't even have that much of great scores and still
Okay.
they match. But you should do your best to score as high as you can. So be sure you're ready. Study well, have study partners, study well, and then you can go ahead and write your exam. But sure, Aditola, I think you can book your exam. You're ready.
Yes, so you've heard it, Adetola. Please go ahead and book your exam, but make sure you prepare. Your intention is not just to write the exam, but to pass the exam and pass it well with a very good score so that it gives you an edge for matching and going into residency if that's the path you are hoping to go. So the second question is from Adesonya Oluwadamilola. And he's saying, hello, does your choice of residence, your province, influence the licensing process or timeline in any way?
So your choice of residence.
I'm living in Ontario. Does it influence the process of licensure and
So
also the timeline?
So I would say there are different arms to this. Some people are in Ontario because they choose to be in Ontario. They're probably Canadian citizens already, or they're PR. They came in as permanent residents and they came in via a certain route, probably the federal stream, skilled worker stream, or via the Ontario nomination program or
Mhm.
whatever. Now, if you did the provincial, you came into the provincial stream, I don't think you can really leave that province until a certain number of years. I stand to be corrected.
Yeah,
But
you're correct. Yes.
yeah, but if you came into the federal skilled workers stream, I think you can go anywhere. Now, having cleared that out, I think it's up to you and what you get. So the way I see, some people have said, this is what I want, and that is what I'm going to go for. I'm not doing anything else. It's not wrong. That's what you want, right? Some people have been very fortunate to get the same city where they live in, which is amazing. Some people have not been, people like me. My family is in London and I'm not in London. I'm in Sault Ste. Marie, like I said. It's about 9 hours drive
Wow.
from London to Sault Ste. Marie. If you're going to Chicago, it's about 5, 6 hours. But point is how it's about you and what you want. For me, going to the north, I applied far and wide. You don't want to know how many. I applied to over 35 programs in the first
35.
section. Yes,
Wow.
I applied far and wide. I really didn't care. I just wanted to go. I was willing to do it. It was one of the things I was willing to do. My family, I had my family support, by the way, to do. I saw it like it was just a time frame. When I'm done, I could decide, okay, maybe my family moves there, or I'm like,
You
okay,
come
you know
back.
what, I don't think I want to stay there. I want to go elsewhere. Point is, all I wanted was to get my license and practice. Right. So it's up to you. I think spending time, most of us IMGs, and I think Oneness can also help with putting up something about that, is taking time to research what exactly do you want, and that thing you want, what is required. So PRA, okay, I'm in Alberta. I want to do the practice ready program in Alberta. If you're eligible, why don't you do it? Okay, you're in
Okay.
Alberta, you want to apply for residency in Alberta. Do you meet their qualifications? And what if you get Ontario? Ontario is a great place to be too. So I don't think it's a problem.
All right. Thank you so much for that clarification. All right. The next question is this: what is your advice to those who are preparing their CAMS application for 2025, especially in terms of the kind of references they need?
Okay. Yes. So let me mention that I think I skipped this part. So one of the things mentors also help you with, especially if they've worked closely with you, because for CAMs,
Mm-hmm.
particularly for references, they really want it to be people who have worked and observed you. Although I think there are areas where they can actually take, they did not observe or they never had that kind of experience with you or relationship with you. But it would
Okay.
be great to have people who have observed you. So mentors can also do that. That's one thing I also benefited from one of my mentors, the psychiatrist I had worked with. I got a very good reference because he communicate he mentioned, oh, she's very great at this. The things he always gave me very for, yeah, the feedbacks I always got while working with him, he put all of those in writing. And I think it was one of the things I really didn't get to really see the reference, but he told me, I mentioned all the things, and I was like, oh, and he told me the things. You always do good with this. Yeah, so why would you think you wouldn't get this? It always made me feel like you can do this. You're great. Yeah.
We all need that encouragement too, right? Because
So
sometimes imposter syndrome can set in, especially when you're trying everything and sometimes it's blurry. You need that push, like, don't
yeah.
worry, you got this. Yes.
So in terms of the kind of references, I would say if you're going into psychiatry, if you can get people who are psychiatrists who know your clinical skills and can speak to your character, they can speak to the things that they are looking for, that they've literally written out in the program, the information there, then you're good. If you know just one and they need three, you can go ahead and get a family physician, provided there are people who can speak to
To
who
your
you are.
character.
They can speak to your character, they can speak to your clinical skills. Some people say, oh, it has to be people in Canada. Absolutely not true. Some people
Oh,
have matched with references, complete three references from Nigeria.
okay.
However, if you have from someone in Canada, it's great. Having someone in a system where you are looking to practice actually speaks better. You know, think about it. You
Yeah.
have someone who it speaks great, but doesn't mean that if all your references come from Nigeria, you won't match. No, there are people that have matched, even in hard specialties like ophthalmology, who had references from Nigeria.
Wow.
Yes. So it doesn't mean that you cannot do it, but just let it be someone who can speak to how good you are, the
Yeah.
value you're going to add to that program. I think that's what matters. It could be someone in the UK, it could be someone who's already in the UK, somebody in the US, provided there's someone the person can speak to that. That's all that matters.
Oh, thank you so much, Dr. Amaka. I know some people have tried to match the first time, some second time. and like that. And so, what advice will you give to IMGs who may have maybe face some setbacks during their residency application process? They've tried, done all they know, but they still did not match. What advice would you give to them?
So first thing I would say is it doesn't mean you're not good enough. Not at all. Some people who match, I have a couple of very close friends who are like sisters who I would say are way better than I am, but even did way better than I did because had more interviews. But sometimes the whole matching thing is really not about that. Sometimes it's about the number, maybe for the particular place you got an interview. So point I'm trying to make is it doesn't mean you're not good enough. It doesn't mean you didn't have what it takes. Because sometimes you get to that point where you feel like you are less of yourself. My interview, maybe I don't speak, maybe no, it's really not about that. I think
Yeah,
it's just getting the energy, the courage, confidence. It's hard to actually go a second time. But just telling yourself, I'm going to give it a harder push
push.
the
Yeah,
next time. The
yeah.
next time. I think that's really what matters.
Yeah, and also to add to what you've just said, based on what I've heard people say and some personal experience, I think surrounding yourself with people
Right, people.
like that will encourage you, because it is enough that you are feeling bad and you're still surrounding yourself with people that will make you feel bad. So you need to change
Yes.
your circle to people
Yes.
that will elate you. And also
Yes.
another thing is based on what you said for your own personal experience,
Mm.
spread your
Spread your wings.
application.
So that's one thing someone had told me. So
Yeah, spread your
one of the
application.
mentors who said,
Mhm.
make sure, although he was a Canadian medical graduate, he said, I realize a lot of you international medical graduates just want to stay in your province.
Yeah,
You're just
Ontario,
applying for more
Alberta.
programs.
No.
He said, get the money. If you need to take a loan, please apply far and wide. Just make
Yeah.
sure that the program meets what you need and
Hmm.
actually has what you want. Just apply far and wide. It doesn't matter if you have
Yeah.
people there, it's the future that matters, right?
Hmm.
Yeah.
Yeah. Thank you so much. Just what will I say now? To because our time is fast spent. So I just like a wrap up thing. Okay. So can you just share how will I put it now? Insight with us today. Just share, give them some words of encouragement, because
Okay.
I know someone is on their bed now thinking about something. Oh, this program, how just maybe by just listening to this, it will lift their spirit. Can you
Yeah.
just share a word of encouragement to them?
Yeah. So I would say IMGs are part of the most resilient people in
Mm.
Canada. Not just IMGs, like overall, internationally trained health professional or internationally educated
Healthcare professionals.
healthcare professionals, we are resilient people. It takes a lot to leave your well paying job and probably great status in your country to move
Mm-hmm.
to Canada and start afresh.
Yeah, I
Some of
mean,
us had to do Uber and skip the dishes. Yes, to put food on
I
the table
know,
and
I
even
know.
fund your exam. It's
Yes.
a lot. Think about that. See yourself as strong and you can do it. Don't let anybody let you know otherwise. Yes, it takes some people 10 years, some people 8 years, some 5, some 3, some 2 years, some 1 year. It doesn't really matter. It's not about who starts first, it's about you
We
getting to
finished
the place at the
well.
end. What the thing is, how is the journey for you? Okay, you're going through it, even if you encounter some pitfalls. Yes, you may have a couple of people who may not encounter that. It doesn't really matter. What can you pick from there? What extra thing? You're applying for CAMS. Okay. Your personal statement. Have you actually shared it to other people? Have you consulted with people to say, oh, who do you think can help me look at this personal statement? Who do you know that can help me review my CV? Oh God, I think I need better references this time around.
Mm.
Consult with people. Who do you think will be better? I have these six choices. Of six of them, which of them do you think is better? My interview, I think I got so many interviews and I think I did great there. My interviews, what do you think I need to change? And have that practice. It still falls back to the community. So having a group of people and also having accountability. I had
Partners.
accountability partners during my residency, and they are one of the best things that happened to me in Cal. But they turned out to be very close friends because we became very close. We would do everything together. Make sure there's some mistakes I didn't make because they were like, "Have you done this? Have you checked this? Are you sure you have done this? I read this. Check." And I'm like, "Oh my God, I didn't see that."
You find yourself.
Having an iron
Yes.
eye, you also will say things that they would benefit from sharing information. It's not a competition, it's a
Mm-hmm.
journey that you hold hands and go together. But you can never, even if it's you're working with one person, point is you cannot do this journey alone.
Alone.
Yeah.
Yeah. Thank you so much, Dr. Amaka. I really enjoyed my talk with you today, and it's so enlightening and inspirational at the same time. I really want to thank you for sharing your valuable insight, and I also thank our audience for joining. And please, I know we are at the end of the program. This discussion is on our YouTube channel. Please try as much as possible to subscribe and also share with your friends, share with your family. Who knows, someone might just listen to some part of this discussion today and it will really help them a lot. And also, please don't forget, we said we are from Oneness Education Foundation. And one of our goal is to make sure you move from non-practicing status to a practicing status within a very short period of time. So you can reach us. We will always be here to listen to you, answer your questions, and help you as much as we can. So, Dr. Maka, thank you so much.
Thank
I
you.
don't know how to, I really I felt good within myself too, and I some of the things I've learned today also I will also share with other people. Guys, that will conclude our session for today. Please like, share, subscribe, and share with your friends, share with your family, share with everyone around you, and we see you some other time. Do have
Thank
a blessed evening. Thank you, Dr. Amaka. And my regards to your family. Thank my big thank you to your husband and your children for allowing you grace our studio, our screen today.
No problem. Thank
Thank
you.
you. All
Have a
right.
great night,
And
everybody.
you
Thank you,
too.
Mom. Bye.
Thank you. Thank you. Thank you. Bye.